Hi, I'm Dr. Joe Tanti. I'm a chiropractor here in Edmonton, Alberta. I'd like to share with you my approach to providing care and a little bit about what I do and who I help. Now, my primary goal as a chiropractor is to get you the results that you want. Maybe you're dealing with some type of pain problem, such as back pain, neck pain, shoulder, elbow, wrist, hips, knee, or foot pain. Maybe you're just sick of dealing with headaches or have bad TMJ. Maybe you're tired of not being able to do the things that you want to do and you feel that your body is holding you back. So whether you want to get out of pain or get back to doing what you love, or you just want to get to the end of your workday without disruptive pain, I can help. You're probably thinking about how can one person be an expert in treating all of these different problems? And it's simple. I'm an expert in what's called the neuromusculoskeletal system. That basically means that if you're having problems with your joints, nerves, discs, muscles, tendons, or ligaments, I can help. If you're having tooth pain, gastrointestinal issues with your other organs, your thyroid, heart, lungs, liver, I'm not the person that you need to see for those issues. So that's what I do, and here's a little bit about how I do it and what you can expect as a new patient in the clinic. The first thing I do with all new patients is a detailed history. I need to find out where you are in your story. What led you to this point? What are your goals? How is things being impacted with your body and in your daily life? And find out what your goals are so we know where we need to go moving forward. The next step is doing a detailed examination. This is going to include several orthopedic, neurological, and chiropractic tests. We do this to determine exactly what's going on with your body and what we need to do. So based on the results of these tests and what your goals are, we can now develop the most appropriate treatment plan to help you get the care that you need quickly and effectively and safely as possible. Sometimes that treatment involves treatment here in the office. Sometimes it requires co-management or referral to other healthcare providers. And frequently it includes providing you with strategies, stretches, exercises that you can implement at home to help speed up your progress. Now, one thing that you may want to know is my number one rule for treatment. That is that it's your body, so we go by your rules. And what I mean by this is I'm not going to try to force you to do anything that you're uncomfortable with or anything that you don't want to do. For example, I have many patients that don't want me to even come close to their necks. Some people let me treat their neck, but they don't want me to adjust their neck. They don't want me to crack it. So what I do is do what they ask. If they don't want me to touch their neck, I don't do that. And if they don't want me to adjust their neck, but they're okay with me doing other therapies to their neck, then we do those as well. The reason we're able to do this is we still get results because I have many tools and strategies to help you get better in a way that's safe, effective, and that you're comfortable with. Now, I know that some people get caught up in name techniques or specific treatment modalities. They'll call and ask, do you do XYZ technique? Because they feel that it's the only thing that's really going to help them. Now, it's really important to remember that the diagnostic process is probably the most important part of this whole clinical encounter. But people still want to know. So I'm just going to provide a short but somewhat incomplete list of the therapies and techniques that I'm familiar with and do in the office here. They include diversified Thompson technique. I utilize classic chiropractic adjustments for the back, hip, knees, neck, extremities, shoulders, elbows, wrists, knees, feet, ankles. I use a drop table, activator, various levels of joint mobilization and muscle mobilizations to all areas of the body, as well as end range loading for those with directional preference, soft tissue techniques such as post-isometric relaxation, pin and stretch, myofascial release therapy, myofascial release technique, trigger point therapy. I utilize various taping techniques. We have therapeutic ultrasound, class 3B low-level laser therapy, as well as radial shockwave therapy. We also provide foot orthotics, and I provide patients with easy to implement exercises to help get you stronger and raise your resiliency. I know that sounds like a lot, that's a mouthful. Let's just summarize and say that if you've been in an accident or if you had an injury or you're dealing with some type of pain and just want to feel more functional, mobile, and not feel like your body is falling apart, the odds are I can probably help. So I hope that answers any questions that you may have. If you have any more questions, feel free to reach out just through my email, joetanti@drjoetanti.com, or leave a comment below. Looking forward to meeting you soon.